So first of all, I would like to ask for your permission to use this video for educational purposes. Are you okay with that?
Yes.
Okay, now tell me, I saw you about a year and a half ago, or sometimes around
2.5 years ago.
2.5 years ago, okay. And at that time, I remember you came to me because you had severe back pain. Why don't you explain to me a little about your symptoms before the surgery?
I had stabbing pains in my lower back. I couldn't straighten out.
1 to 10, how bad was the pain?
It was more than a 10. It was pain.
Okay.
And even when I was taking pain medication, it was pain, still pain.
Okay. And I'm just going to swing to the picture here. And when you came here, we noticed that you have a scoliosis, which is very severe. But as you see here, we fixed only the L5S1, the lower level, decided not to do a surgery for all the levels, but just for the lower level. Now, and because your symptoms were mostly corresponding to the lowest disc in your back, and obviously you have a scoliosis, which is quite significant, but because your symptoms were just corresponding mostly to that level, we decided just to do that one level. So instead of doing a big scoliosis surgery, we did a one-level decompression and fusion. Now, the surgery was when?
June 26, 2013.
2013, and we are now in January of 2016. So tell me about right after the surgery, how were your symptoms? How did you do after the surgery?
It was a little better, but I was in very much pain.
For how many weeks were you in pain after the surgery?
I took pain pills. I'll put it this way, the surgery was in June. By the end of August, I was off all pain pills.
So your symptoms start getting better?
Yep, they started getting better.
It took somewhere between about 2 months or so.
Yeah, it wasn't fast, but progressively I took less pain medication, and pretty soon
so even though we did a smaller surgery, now obviously the surgery is itself painful, but after 2 months you were off the pain medication. So how have you been doing since then?
Good. I mean, I can walk, I can stand, I can climb, I just have to watch how I twist and things. And I wear my brace when I drive or sitting for a long time in a vehicle. But
yeah, and
I don't know. I have to say excellent.
Good.
Because I could not walk before. And now I go for walks even.
Excellent. Now I'm going to go back here, and we are looking again at the pictures here. And this shows practically that we did not correct the scoliosis.
Right.
Because we decided that that would be too big of a surgery. And we decided to do the smallest surgery that can give you the most benefit, and which was the L5S1 decompression and fusion. And it seems that has helped you with overall symptoms. Now, again, we talked about that the scoliosis is still there, and you still have to be careful with overall activities.
Right.
And I think you have a great common sense. You have been doing great, most of the credit goes to you actually for the outcome, that you have been complying with the restriction and so on. And those restrictions are going to stay because scoliosis is still there. But overall, I think we had a pretty good result by doing the smallest possible surgery to give you the maximum benefit.
I agree, yeah.
Thank you very much.